Balance of his time. The gentleman from New Jersey.
Thank you, Madam Speaker. I yield myself such time as I may consume.
The gentleman's recognized.
Madam Speaker, there are millions of Americans currently in need of a long-term care program and many more that will require these services in the future. Despite the great achievements of our country, the U.S. lacks an affordable and ethical system of financing long-term care services. The CLASS program is a significant step towards finding a realistic solution to this problem. However, many of my Republican colleagues have taken a stance against CLASS without proposing any real solutions for long-term care access in America. And I strongly oppose H.R. 1173 and consider it to be a blatant disregard of a growing crisis in this country. Madam Speaker, Republicans continue to propose repeal of various aspects of the Affordable Care Act. We heard my colleague from Georgia today, and how many other times, how many on the other side have said, well, let's just repeal the Affordable Care Act, let's repeal pieces of the Affordable Care Act, but they never come up with any meaningful alternatives. And the same is true today. They're talking about outright repeal of CLASS without any meaningful or suggestion of an alternative. And my message to my colleagues on the other side of the aisle is that we should mend the CLASS Act and not end it. This country is already facing a long-term care crisis, but the problem is only going to get worse. As our population continues to age, an estimated 15 million people are expected to need some form of long-term care support by 2020. If we don't solve the need for affordable long-term care in this country soon, we will also jeopardize our entitlement programs. Currently, Medicaid pays 50% of the cost of long-term services, and that price tag is quickly rising every year. The CLASS program was designed to allow people to stay at home and prevent the costs of nursing home care that burden Medicaid. Now, I want to correct one thing. I know in the Rules Committee, some of my colleagues talked about the administration's position on this bill. The administration made it quite clear in a hearing that we had on this bill that they are opposed to repeal of the CLASS Act. They acknowledged there were workable solutions under the CLASS program that didn't feel that they had the legal authority, I stress legal authority, to implement them. So the Department of Health and Human Services has more work to do, and I have suggested on numerous occasions that the CLASS Advisory Council, which is organized under the legislation, be convened in order to offer their expertise. The CLASS program is a framework that will facilitate a solution to our long-term care crisis. However, all I continue to hear from my colleagues on the other side of the aisle is that Congress can't do anything. It's this negative attitude, the idea that Congress can't address any problem. And I just sincerely hope that my colleagues, when they come to the table, come up with a workable solution. Don't just tell me we have to repeal things, we can't do anything, the government can't do anything. Cowardly running away from the problem through repeal is simply not the answer. Overall, the CLASS Act promotes personal responsibility and independence. That's the values that you talk about a lot. It allows the government to put choice in the hands of consumers while saving Medicaid dollars. American families have too few long-term care options, and they need our help. Rather than repeal CLASS, we need to continue the dialogue and the development of a viable plan forward. Again, let's mend it, not end it. Moving forward with H.R. 1173 shuts the door on a problem that simply cannot be ignored. And I reserve the balance of my time.
Gentleman reserves his time.